Hello, welcome back to the show. Today we have with us Nidhi Gupta. She is a senior researcher at the National Research Center for the Working Environment in Denmark. She served as a postdoctoral fellow at NFA after completing her doctoral degree in sports science at the Nanyang Technological University in Singapore. Dr. Gupta has contributed to various national and international research initiatives dedicated to promoting accurate assessments of physical work demands and improving the prevention of musculoskeletal disorders. Today, we are joined by our producer Neha Rao, and I am your host Aditi Bhatt. Dr. Gupta, welcome to the show.
Thank you, Aditi. It's a pleasure.
So, we ask everybody this, and I'm really curious to know about your journey as well, seeing as you started in sports science. How did you become interested in studying occupational health and consequently becoming a senior researcher at the National Research Center for the Working Environment?
Well, actually, occupational health was not my dream. But when I started, I always wanted to be in a field where I can help people. And people wanted me, in my family wanted me to be a doctor because I can help people, but it was not my type. My sister is a doctor, by the way. But then I started to work in the sports science field, did my PhD there, and there my scope was to help the athletes. But I realized I have to go a little bit more broader, and that's why I came to occupational health field, because here I can go much more broader. I have the possibility to touch upon the whole working population. So that was my main motivation to come into occupational health field.
So let's talk about your research interest. They lie in developing user-friendly wearables for measuring physical work demands at a large scale. How does wearable technology fit into the understanding of MSD and physical work and the connection between them?
Well, actually, as you know, MSD is a big problem for workplaces and among workers. Is a big one of the main burden is because of the MSD at work. And we know that one of the main risk factor is physical work demands, ergonomic demands, we call them, or physical work demands. The number of terms we are using to define the physical work demands. For example, people are doing prolonged sitting, prolonged standing, lifting a lot of heavy weights, and so on. There are a number of examples of physical work demands. So what we do currently at workplaces, the most popular trend is that when people have problem of pain, then what we do is we do an assessment of how big is the problem and what is the main reason behind it. And then we give advices on what to do about it. And then we implement some, change at work so we can improve in this condition. But what we have done currently is we're using self-reports mainly to assess what is the problem. And we are using interviews and observations. And we know by research right now that all these information give you some biased information. And that means when people feel hard, they will tell you they have done a lot of heavy work. So if you ask a person who has a lot of pain, then if you ask them, have you been lifting your arms above your shoulder level for a long time? And they will say, yes, almost 100% of the time, because they feel hard in their body. But in reality, that might not be true. There could be some other reasons that leads to pain. So we have to get a good picture of what is the problem actually, and more specific information of problem. So, and that information we don't get that usually from workplaces because we are primarily using self-reports and interviews and observations. So there comes wearables into picture. We can use wearables to better assess the problem. We can do proper measurements. We can do proper risk assessment to know. We can go down to second by second or minutes of how many minutes you've spent on physical work demands and where in a day, how many in a day. So how many minutes in a day and where in the day of the work. So that kind of information is needed to make good changes. And people take this information seriously because it's objectively measured.
Right.
So, and that's why wearables is the future, I think, because that's the way to go. But of course, problem is that we don't use wearables so much at work. Maybe you have seen also in India, not many workplaces actually use the wearables at work. They're just fancy things.
From what I'm seeing, it's not enforced in a workplace, but a lot of people are now using some sort of biofeedback, like a smartwatch or something more often. But that's just a personal choice that they're making.
Exactly. it's like a personal choice. They're using for lifestyle. They're not using
Yes,
for changing their work so they can reduce pain because of work.
that's right.
And probably you've seen it in IT sector in India, but
Yeah.
you haven't seen a cleaner wearing a smartwatch, checking their
No.
work. It's very not regular, but it should be regular. It's not. It should not be that difficult to do your job. I mean, it is difficult to do your job, but if you can do something about it, it doesn't feel so hard to do your job, then you can sustain your life along and you can have better quality of life. So that's what I think wearables come in picture. It gives you better measurements, better risk assessment, better recommendations, and
Right.
also help you tailor the intervention or tailor the change that you're making. Today you felt like, okay, the change I'm making is not really fitting to what you think it should fit in. Then you can make the changes. And it's easy to connect all the people who are relevant to make a change at workplace, like your practitioners or OHS
Mm.
professionals, workers. They can be connected to each other through wearables that you can't do with self-reports or observations. So,
Right.
so that's what I think it's a wearable coming into picture to target physical work demands and MSD.
This is just blowing my mind a little bit because we always talk about how to manage WRMSTs better, and we talk very little about how to assess them and how to objectively measure them. So this is, and I never really looked at, of course, coming from somebody who's not from this background, using variables as a way to measure objectively and to get and use that information to build better interventions. So, what are some things that we can consider when incorporating wearables into a work environment?
Yeah, so I think we are at a very starting position here. We are on a start mark right now. We are not very ahead using the wearables into workplaces. I mean, we know all the benefits of using wearables at work, but we're still not using. So I think the advice of how to integrate wearables at workplaces would be that I think most of the time when I talk to the OHS professionals who are the building bridge to handling the problem at workplaces, they think wearables are very cool, but they're not using it because they think they're very difficult to use and they're very costly. And we need a expertise on this. We don't have any education on this. So how can we use it? They don't know how
Right.
to use it. And I think so we have to make sure that the wearables that we're designing, it's very handy. It's very easy for practitioners to use. So we need to design wearables for that are designed for HS professionals who can use these in their own practice. They can earn money on this, giving better advices, better services to the workplaces. So easy to use is definitely one um,
Yeah.
element. Then second thing is should not be very costly. If it's very costly, people will not use it. And then it should be something that is fitting to the workplace systems. You don't want to come into a very fancy system that people can't relate to. So you want to develop a system which can be integrated into systems that workplaces are using. For example, a system, let's say a workplace use a system to design their work routine, day routine of the workers. Then you should have a system that can integrate into that routine because you want to target different the time spent on different physical work demands. That can only be done when you know that your system is talking to the system that they're using to design the time, how
Right.
to organize your time in a day. So it should be integrated. And the fourth thing is data privacy is a big issue among wearables, right? The workers have to accept the system before they use it. And if they're not confident that the information that they're measuring using wearables is not going to get used in a negative way, some people may be using it to, fire people, and some managers are, problematic. So they will use this
Yeah.
information to in a negative way. So data privacy and how do you present this information in a safe way to the workers? It's very important. It's one of the areas where we need to work together. And of course, OHS professionals, when they're bringing their wearables into workplaces, they need some education how to use this. That we
Right.
are not having any courses right now. We don't have education in their curriculum that they get education on how to use wearables at workplaces. So
Do you have any examples or any insights from any projects that you worked on where you can lay out sort of a real life situation in a way that you maintain privacy?
Yes, I mean, there are a number of projects. I mean, I've been working into uh, objective measurements using wearables for last 12 years now and our institute NFA. They have a big history about promoting objective measurements. So there are lots of examples, but I've worked with projects where we can do proper risk assessment using objective measurements. So we finished a project called Prodesa where we could first tell people that if you do 5 minutes of lifting your arms above your shoulder level, which is a big risk factor for pain in the shoulder, then you have so much risk. Till now, what information we have is using self-reports. And then self-reports are very approximate, like 25% of your time or 75% of your time spending on arm above shoulder level. And people who have pain, they will always say yes, 100% of the time. So that information is not very useful for workplaces. So what we have done in this project is to get even the minutes, how many minutes of your work that you spend on arm lifted above shoulder level leads to pain and sickness absence in the future. Because that is the risk assessment that you inbuilt into wearables when you go to workplaces. Those are some of the past projects, but now I'm working a lot of projects where we're designing these wearables that are easy to use for now we are designing some systems that are used for easy to use, very friendly, user friendly wearables that we can use for cohorts, data collection, the cohorts and surveillance. And then I have recently got a funding to take the step further and exactly designing the system that we just talked about, a wearable for practitioners, OHS professionals.
Right.
So we can integrate these wearables to reduce the harmful effects of physical work demands and prevent MSD at workplaces. So that is exactly we got funding for. So we just started this year. So cannot tell you more about it, but we have something coming up in the future.
That's exciting. Looking forward to that. So at Ribbons, you're giving a keynote and hosting a 3-hour workshop on wearable technologies and methods. What message do you hope that attendees take away from it?
I guess the first thing I want to tell people is I'm hosting this in India and it's my first time and I'm Indian. That's my home country. So first thing what I want to do is to make people aware what is out there in the market. What is the future? That's what I want to make people aware about wearables and self-reports and problems with them and what is the future, basically. That's the first thing. And then second thing I want to do is to encourage people to start using wearables. When people don't use them, you don't develop them further. We don't know the problems that are coming with the usage of wearables at workplaces. I want to really motivate people to use the wearables, and that will really help. And that's the third point, is that will really help to start the critical discussion around wearables. And that is the foundation for making the wearables very easy to integrate in the practice at workplace. That will be the solid foundation. So those 3 points I want to take home when I finish my workshop and the keynote.
So I want to ask you a question. What are some challenges that you have faced when you've been trying to implement a wearable technology into a workforce? And how did you sort of manage to overcome, or how did you and your team overcome that challenge? And do you have any advice for people who are trying to do the same thing?
I think, as I mentioned before, the main challenge that we usually have is the data privacy. And I know in Denmark, we don't have that problem so much. But I know in many other countries, we have this.
But also in Europe, there is a government law that protects citizens, which in India, it's starting, the movement is starting, but we're not quite there yet.
Yeah. But it will come in the future, hopefully. Yes. But I think that data privacy is one of the main challenge around wearables. So in Denmark, how we treat is because we have such a solid work environment system, that people have a little bit more faith into these wearables because of that. And then NFA, our face is quite valid here. We have a good credibility in Denmark. So when we come as NFA researcher coming to do some research, people have a little bit more faith, but still people have a lot of challenges. And in using the wearables at workplace because they think information might be used in a bad way. I don't have a I don't think we have a perfect solution yet. But I think the personal communication with them to tell them how we're gonna use, show them, be very transparent to what you're gonna use this data for, how the data will look like, what managers can do with this data. This transparency is very important. And that's how we have solved till now. And that has led even us to use the wearables into their leisure time as well, because that is something they're private. We can't force them to use into leisure time.
Right.
But they were okay with it because we were so transparent and they trust us as a researcher that we will not use the information in a bad way. So that's definitely one thing that has been a challenge. I'm thinking more other challenges. Yeah, I think it's also this difficulty around wearables. As I mentioned before, one of the main challenge for practitioners to use the wearables into workplaces because they think we need a scientist with us to use the wearables at workplaces.
Right.
And again, uh, that's why we are developing this solution. So when you ask for the challenge and how we overcome, I think the overcoming part, as I said, we are at a starting phase right now. So we
Yeah.
don't have a perfect solution for how we overcome this. But definitely we know the challenges. And I'm hoping with this Ergo Connect new funding that we have gotten from EU, that we will actually make a solution to overcome this challenge where we can design a solution for practitioners and they don't need us to come with them to do a intervention at workplaces to handle MSD.
Because it's so intuitive, they can just do it
Yeah, it
themselves.
should be like regular practice, just like wearables, smartwatches, right?
Yeah.
That it should be that way at workplace. That it should be so regular that they are just using every day without thinking, and people are feeling safe. I mean, if you look at this, this is Android, Google, right? People, there are a lot of problems around Google, but people still somehow it's so distant for them. They think nobody's gonna use this data.
Yeah, I was just going to say, I was like, I'm not sure Google's the best example.
No, exactly. People trust somehow, still give data, but now around workplaces because now it's about their work, right? It's about salaries, it's about their job. Then people are very sensitive, and it makes sense, right? It's about their bread and butter they're getting from work. They're not getting from the smartwatch. So that's why we have to be extra careful when we're designing wearables at work.
That makes sense. Thank you for that insight. Last question. Do you have any advice for students or people who are interested in pursuing a career in the field of occupational health?
When I'm hearing this question, I really laugh at it a little bit because I think I feel I'm not that, um, not big enough. I'm not a professor or somebody
But
who would
for
say,
somebody who started in sports science and then eventually moved on to occupational health, surely you have some insight into what drove you to make that transition.
I think the advice I would give is, of course, there could be many advices that I have learned a lot from. First thing is the networking. I think I have gained so much out of my networking. I have a big list of my collaborations around the world. So that is definitely, whenever students out there in the conferences and in meetings, they should make the best usage of it. Don't be shy. Just say hi. Everybody's thinking in the conference, how can I say hi? I was always thinking this to somebody, a professor, somebody, just go and say hi and people will talk to you. So that's definitely first thing. Networking is definitely a thing and don't be shy to make one. The second thing is think about what you want to do in the future. Are you going to be the consultant? You want to be a researcher? And then have a proper education. Think from now what kind of educational background you should have. And for that, you need networking. So you can reach that goal that you want to do in 10 years from now. And I think because I'm so much into technology, definitely I think students should think that technology is the future. No matter if they work in wearables or some other field, technology is the future. So be aware, read about technology, be aware with new technological advancements. And also don't be shy to open your ears to other fields. I know that people want to be expert in one field and not so much into other. You don't have to be the expert on different fields, but when you open your ears to other fields, you might get ideas that you haven't thought right now. But because you heard that presentation from other field, you think, oh, that I can probably do together. So these are some of the learnings I have done till now that really helped me to shape my career now. So I don't know if it's advice, but it's something sort of learning from me that I
No,
have done.
that's really good takeaways, though. Thank you for that. And thank you for your time, Dr. Gupta.
Thank you so much, Aditi.
Bye.
Bye.